Dealing with the cost of Medicaid is topping the agenda at the National Governors Association meeting in Virginia this weekend. Florida, Iowa, Louisiana, and South Carolina already plan to opt out of Medicaid expansion in President Obama's new health care law. They say the cost will overwhelm their budgets. Several other governors say they're considering the same move, and with the election just months away, implementing the president's health care plan is becoming a major campaign issue. Bringing in now former Democratic Congressman Joe Sestak and Cal Thomas. He is a syndicated columnist and a Fox News contributor. Good to see both of you, gentlemen.
Hi, Arthel.
Congressman, I'm going to start with you. Opting out, okay, let's talk about it. How much of this is about partisan politics or the state's pocketbook or principle in that the states are saying, hey, look, let us make our own decisions?
I think initially there are those that their ideology says we don't want any more government involvement. But the fact is that today 60% of the cost of Medicare are state requirements over and above the minimum federal requirements. Here's why it's fiscally prudent to do it. Take Arizona. Back when we passed Medicaid in the early 60s, many states didn't opt in initially. Arizona was the last holdout. But over 6 years, it saw that the cost of the uninsured had risen by 300%. And it said, I got to Medicaid because if I get them covered, they will come in when the cold can be treatable rather than wait until it becomes pneumonia, and it costs us a lot more to cover them. So it would be fiscal malpractice for them not to get people covered. As CBO said, Congressional Budget Office, it won't cost us anything by the end of the decade, and in fact, we save money in the next decade.
Okay. Look, Cal, let me point this out first. I know you're going to jump in there with some different numbers. I'm sure you see it from another perspective. But on the morning talk show, one of them, White House Chief of Staff Jacob Lew, pointed out that the government will pay the full cost of covering the newly insured in the first 3 years and never less than 90% after that. So, Cal, I ask you, though, do you think that would create a cash conundrum down the line for the federal government?
Well, there's already a cash conundrum, Arthel, and let me save this soundbite. Let me ask you to save this soundbite. I agree with President Obama, who in 2009 said it was foolish to pour more money into a broken system like Medicaid without reform. I agree with that. Bob McDonnell, the governor of Virginia, said the same thing. 17 of the governors in this country, 17, have something in common. They have balanced budgets or surpluses like McDonnell or Mitch Daniels in Indiana, or they have, what did I say? They have surpluses or balanced budgets, yes. So what we need is reforming of the system. I happen to agree with those who favor block grants from Washington to the states. One size fits all doesn't make it. Look, we need reform of Medicaid, Medicare, and Social Security. One is going broke. The other two, the one is already broke. Two are going broke. We can't continue as we have been.
And, you know, listen, Cal, there's the other part of this argument, though, because we can't forget about the people. Some of the folks argue that the governors, if they choose to opt out, we're looking at millions of low-income Americans who recently became eligible for health care coverage. All of a sudden, they're going to be uninsured, and that's one of the central parts of health care law. I ask you, then, what about, I'm not disputing your call for reform, but how do you do it and where the people don't fall through the cracks in the meantime?
Well, first of all, there is no federal right to health care in this country. This is what the debate about Obamacare is all about. And if there is a Republican Senate joining a Republican House and a Republican president, the nominee for the Republican Party, the presumptive nominee, Mitt Romney, has said he's going to fix it. There are many, many good plans out there, from think tanks like Heritage and Cato, the Libertarian Group, to Paul Ryan's reform proposals.
Cal, I got to get to Joe, but Cal, before I let you go, no, hang on, Joe, because Cal, give me an example, though, specifically of what some of those think tanks are saying. Just one example.
Well, look, first of all, Paul Ryan's plan is brilliant. It's not perfect. We need to devolve the power from Washington to the states. No one-size-fits-all anymore. No federal control. Another look at the 10th Amendment. The Constitution limits the power of the federal government and empowers the states. That's just for starters. People can Google the Paul Ryan plan and read specifics for themselves.
Well, I don't know that I'm going to edit myself there. I'm going to keep going over to you, Joe Sestak.
It's very interesting.
Let me say this, though, because seriously, then if Cal is, if what he's saying is right, then the onus is on the states to oversee the Medicaid distributions. How do you think that will turn out, in your opinion, Congressman?
Well, I respect Cal, but you've got to look at the facts. No solutions over the past decade have done anything to stop 160 Pennsylvanians every day from losing their health care. Between now and January, that's the equivalent of the state capital of Pennsylvania, Harrisburg. By doing nothing, you and I, Arthel, with Cal, are paying for those uninsured about $1,000 more on a private health care plan, because when they go into the hospital, the state has to pick up the burden for 20% of the uninsured. Then the health care companies pass that on to you and me and Cal because they don't want to pay for it, by higher premiums. So standing by and just saying doing nothing, or as Cal said, let's make block grants. Bloomberg Business came out yesterday and said, if we do that, it means that those seniors who are on long-term assisted care will lose billions of dollars. Here's the bottom line. In the military, we give health care to everybody, not because we're liberal, not because we're socialist. We give it because we wanted our SEALs and SEAL Team 6 to be productive warriors and not leave the military to cover their children. We lose $150 billion every year because of the under and uninsured. We need people covered so that we compete with China. It's pure, simple, pragmatic leadership.
20 seconds, Cal.
Well, look, the real block in Washington are the Democrats. In the Senate, they have blocked every reform, Social Security, Medicare, in the House.
I'm going to jump in and end it because it's going to go political and talking points. Cal Thomas, thank you very much.
Good
to be with you, Arthel.
Listen, I'm glad, happy to see both of you, but, you know, we got to keep the focus on the people.
It's a fact.
Cal Thomas, thank you. Joe Sestak, thank you very much. Good to see both of you. Thank you.
That was spirited, wasn't it?
Absolutely.
Yes, all right. Florida